More than 2 million Americans have an irregularly irregular heart rhythm known as atrial fibrillation. This condition occurs when the upper chambers of the heart are not beating forcefully enough. They're sort of quivering instead. This can result in blood pooling in the chambers rather than being pumped out. When blood pools, it can lead to tiny blood clots. In a small percentage of people, these clots run a risk of breaking loose and traveling to the brain and causing a stroke. This is a serious problem, but it is a problem that cardiologists can manage with a medication called an anticoagulant, also known as a blood thinner.
So when we say the blood is thick or forming clots, there are certain proteins involved with clotting in the bloodstream, and these proteins get activated to actually gel together and form blood clots. The blood thinners or anticoagulants that are on the market now have the ability to inhibit some of these proteins and prevent the blood from gelling and forming blood clots. And many people have heard the word Coumadin or warfarin is a blood thinner that's been around since the 1950s that thins the blood, and that's the original anticoagulant that we have, and it prevents clots within veins in the blood vessels of the body.
For many years, the blood thinner warfarin was the only medication that reduced the risk of stroke related to blood clots formed by atrial fibrillation. Warfarin can't specifically target only the blood in the heart. It affects the whole body, which can cause side effects.
The medicine Coumadin, warfarin, that we've had since the 1950s has been a little tricky to manage. Everybody's different, the dosing they require. People find that it reacts with different foods they take, salads, vitamin K related products interact. There are genetic factors that cause interactions with how people respond to Coumadin. It requires a fair amount of diligence and following through with your physician to make sure that it's safely used. And the pharmaceutical industries have been looking for decades to try to find an easier drug than Coumadin, one that doesn't require the frequent monitoring. And when I say frequent, it might be every few weeks, once a month, so it's not terrible, but there is a fair amount of variability in how people respond to Coumadin that may increase the risk of how it works.
In recent years, the FDA approved 3 new anticoagulants as blood thinners for atrial fibrillation. These new medications don't require the monitoring or cause the variability that warfarin does.
Modern medications that work similarly to Coumadin as what we call anticoagulants. They thin the blood, but they thin the blood more consistently than Coumadin or warfarin does. So if you take a certain dose, you're more or less guaranteed the blood will be thin, and you're guaranteed you don't need a blood test to have to monitor it, and the consistency will be there. We think in the long run that could be safer, especially for people who are very variable in how they respond to Coumadin. Then these new medications are easier and perhaps safer, and perhaps in certain patients even more effective than the Coumadin or warfarin that's been around since the 1950s.
It's very exciting that we have these new medications available, but each patient must have a conversation with their doctor to decide which medication is appropriate for them.
If you're having problems monitoring your Coumadin and your levels are up and down, or you travel a lot, you enjoy having some wine, you have variable degrees of salads which interact with Coumadin, then Coumadin for you becomes a little bit more of a hassle. And in that situation in particular, you should speak to your physician about some of the new products that are on the market and if it might be appropriate for you, especially if your diet varies and you're traveling a lot, or you're just not consistently controlled on Coumadin over the years, then the new medications could be a better and even safer option for you.
No matter what medication you take, all anticoagulants thin the blood and pose some risk of bleeding. For this reason, you should always inform your healthcare providers that you are taking these medications before surgery or other investigative procedures. Anticoagulant medications can also interact with other types of medicines, so you should talk to your doctor before taking any new prescription medications, over-the-counter medications, herbal remedies, or food and drink supplements. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.